For those of you who don't know me, my name's Dr. Chad Savage. I'm Dr. Naomi Cook's partner. So pieces of a puzzle. We are all pieces of a complex and broken healthcare system. Each of us has our own unique contributions, our unique interests, our own political persuasions, our own specialties, our own contributions, and we love every one of you. Because in the next 20 minutes, I hope to show you that when we bring it all together, what an incredible system we can become. Now, I'm not going to say anything revolutionary here. Everybody knows it. In fact, it's probably the reason why most of you are in the room right now. The American healthcare system is broken. We have long waits. We have no choice. We have distraction. We have burnout. We have piles and piles of paperwork. And we have incredible costs. Oh, the costs. For those of you who've seen my discussions in the past, I make the argument that it's the cost in the healthcare system, or at least the illusion of cost, that has actually cost us our autonomy, because third parties have used this to intrude and take away our liberty. So how bad is the problem of cost in the United States? Well, if you were to look at gross domestic product, entire economic output of other nations, including their healthcare system, meaning their housing, their gas, their sales, their manufacturing, the entire economic output of countries combined, we in the United States on healthcare alone spend the total of the combined gross domestic products of these nations. Is it still going? I've got 20 minutes? Oh boy. He's going to get mad at me. He's probably not going to let me talk anymore. Man, I love the peanuts on the plane too. Is it still going? Oh, God. Oh, jeez. Oh, man. Want it, buddy? There you go. Still going? All right. That's good. I brought more. Here you go, Lee. Oh, I can't get them out. Here you guys go. Paddle balls for everybody. It's still going. Ladies and gentlemen, that is 120 nations. That was a nation, 2 nations every second. Now, a lot of you say, yeah, but those are tiny nations. Combined, that accounts for 1 in 5 people who live on planet Earth. 20% of the global population. We spend in healthcare in the United States alone the equivalent of 20% of the global population's economic output. We have a problem. So, the good news is we have solutions that are popping up everywhere. We have all these various areas of innovation. We've got surgical centers, we've got labs, we've got innovation everywhere, but it's all this broken puzzle. So what I want to do, though, is start by focusing on one piece, one very important piece, and that's one we've been talking about for the last couple days, and that's direct primary care. Now, by now, you all know what direct primary care is. It's a low-cost monthly membership. It's budgetable, it's affordable, it's predictable for primary care services. And with that membership, people get all of their medical office visits. Now, this is key for several reasons. First, to the patient. When they pay a lot of money at the time they access care, they tend not to access it as much, which means that they present with diseases in more advanced, more difficult to treat stages of illness. But it's also very important because it's been estimated that in primary care, we can handle between 50 and 80% of all medical problems. And I would argue that when we're afforded the time to be with our patients, it's closer to the 80%. Brandon, in the last lecture, actually did a very good job of describing that. Lost the screen over here. We include all in-office diagnostics, EKG, spirometries, pulse oximeters. We include all of our procedures, joint injections, cryotherapy, ear lavage, and one that's a big topic in healthcare right now, telemedicine. The entire industry recognizes the advantage of telemedicine, the ease of access to your doctor remotely, the way this could really transform the provision of medical care. The problem is the current system can't figure out how to code it, bill it, or document it. Let's back up, Lee. Well, in DPC, we've already resolved that issue. We valued that doctor's time within the membership. So some of these solutions are already being answered. So that is a huge first piece of that puzzle. But DPC doctors didn't stop there in trying to resolve issues for patients. We've included what I like to call DPC services. We went out and with our diplomas and with our licenses said, what other things can we do that can we access to help our patients out? And labs are a big one of those. Most DPC doctors contract directly with labs. We circumvent that third-party payer system, the governmental insurance company complex, to try to get good prices for patients. And I think, boy, we've succeeded in this. So what you see here on the left is our local university hospital labs prices. This is from their transparency website, and I've confirmed it with actual receipts that have been brought in from patients. In the blue are our prices from Dr. Cook and my direct primary care clinic. And what you'll see is for 4 basic labs, lipid panel, CBC, CMP, and TSH. None of this stuff, you guys all know, none of this is remarkable or exotic. Our hospital lab charges $535. We can do the same thing for $20. That's a savings of $515 on one blood draw. So right there, we've added one piece to the puzzle. Now medicines are another one. And boy, is this not the hot topic right now. DC is a buzz. How do we fix the medication problems? You know, people are talking about legislation and such to try to correct it. We haven't solved it all, but at least for generic medications, I believe we have. Because as you can see in this slide, again, the blue is what we have in our direct primary care clinic, and the red is the estimated retail price at CVS according to GoodRx.com. If you look at Plavix alone, 1 month of Plavix at CVS, $114. We are able to provide the same month of Plavix for $1. That means you could get 10 years of Plavix for the same cost of 1 month at CVS. And now people say, well, yeah, but if they get the GoodRx coupon, they may get a good price. And that's probably true for the people who understand that. But what's amazing to me is how many people go to CVS, don't realize there's any negotiation potential there, and actually pay the $114. And if you look over at Norvasc, we can get an entire month of Norvasc for 21 cents. We can treat hypertension, one of the leading causes of treatable premature death in the United States, for an entire month for less than the cost of a single gumball. And if they're a heart patient and we need to throw in some Zocor, well, we can treat both for about 2 gumballs for an entire month. And if they happen to work for the regular insurance company, the insurance-based system, and they have depression, well, we can throw in Celexa, treat all 3 for $1 a month. That was supposed to be funny, by the way. Thank you, Josh. Pity laugh.
I'm laughing at you.
Yeah, okay. So, all right, so medications come into the mix. What about imaging? Imaging, for those of you who've seen my discussions in the past, I have this big slide last year where I went in a big circle and I talk about the false pricing of MRIs. Because they're expensive, it gives justification for the false belief that we need intermediaries, third parties, government and insurance, to pay for those for us. But is that in fact true? Because when you add those third parties into the equation, what do you make them? You actually make it expensive. So as you can see here, we go back to our hospital lab. MRIs through our hospital lab are $4,200. We're able to get that same MRI for $279. That's 94% cheaper. That is a savings of $4,000 on one imaging test. We see the same thing with x-rays. We save $530 for x-rays compared to the hospital lab. We see the same thing with ultrasounds. We save over almost $1,000 on a simple abdominal ultrasound, and we see it with bone densitometry, 92% less, $577 savings compared to our hospital labs. So we go back to our puzzle. And yet another piece comes into the picture. Now, okay, we've talked about lower cost things, and maybe you guys will see a trend here. I'm kind of progressing more and more expensive. What about surgery? That's really starting to get expensive. Is there really innovation occurring there? And thanks to Keith Smith, Surgical Center Oklahoma, and places like that, the answer is absolutely yes. There's even innovation occurring on that front. What you'll see here on the left is that lumbar laminectomy surgery through the insurance model can bill between $50,000 and $90,000. Surgical Center of Oklahoma, wrap price means everything. They're not getting bills randomly over several months. Wrap price, pre-op, surgery, surgical center, anesthesia, and post-op care, $9,900. That's a savings of between $40,000 and $80,000 on one surgery. Welcome surgery. So, now I don't know a single DPC doc who says you don't actually need coverage. We can do a lot of stuff, but there are times when bad things happen and you're in an ICU for an extended period of time or something like that, and you do in fact need coverage. So is there innovation occurring on that front? And I'm very happy to say yes, and we have examples here during this conference of that. We have things like health sharing ministries. We have things like, this is not innovative, the traditional insurance high deductible plan, that's just a high deductible insurance product, but the HSAs. HSAs are great. For those of you who don't know, HSAs are the optimal savings modality. It's kind of like a 401k. You can, and prior to taxation, you can put money into an HSA account. You can invest it. It grows just like a 401k, tax-free. And when you use it, you can use it tax-free as long as it's for medical services. You own it. It travels with you job to job and even into retirement. It is the optimal savings modality. Even a 401k is taxed at some point. HSAs are not. It would be really good if you could separate those from the onerous traditional insurance product, but as of yet, that doesn't exist. There are bills that are proposing to do this. We'll see if they get traction. Short-term limited duration policies, these are the resurrection of the catastrophic plans. Now, these don't cover much. They're catastrophic plans, but they also don't cost much, so you have money left over to cover that calamity. We have indemnity plans. They cover specific disease states, and of course, TPA, ERISA-based self-insurance plans that companies can do, where companies have a much more leeway as to how they design their plans. They can design them around us, around DPC, and there's a lot of innovation and saving going on that front too. And with coverage comes coverage for things that maybe were not included within direct pay approaches. Things like hospitalists and specialists who have decided to not yet engage in these kind of pricing. So with that, we welcome in the rest, and now we see our picture. Our puzzle starts to come together, but we don't yet know really what it looks like. It doesn't look like much yet. So let me show you real-world examples. I'd like to tell you my tale of 3 patients. I'd like to introduce you to Joe, Bob, and Jennifer. Joe is a pretty healthy guy, 39-year-old gentleman. So how do you see this slide? When you look on the left here, the left column is the insurance-based prices from our hospital. The right is direct pay prices from our clinic. So Joe tries to take care of himself, right? You know, he goes in for his annual check. He gets annual labs. He is really pretty healthy, except he's on hydrochlorothiazide for hypertension. So he goes to a 6-month check to get his potassium checked and make sure his blood pressure is still under control. He gets one episode where he gets sick. He gets so sick of paying those onerous hospital prices that he decides to go to the Minute Clinic because he's under the impression it's going to save him money, but as you see in these prices, that's really not the case. He even tries to access good pricing through GoodRx, getting that $4 a month hydrochlorothiazide. So over the course of the year, under an insurance-based approach, even with some rational consumerization of his attempts to access care, he pays $1,600 in costs for his medical care, a healthy individual. In a direct pay approach, he has $526. That's a savings for a healthy individual in a relatively normal year of $1,100 in medical care. But the complete picture is when we look at it in combination with various coverage products. Because some people will rationally say, yes, but insurance would pick up some of those costs. And that's kind of true. The sad truth is they're paying a percentage of a false price. So what does that mean? Well, it's only as good as the number it's based on. If it's a false number, you can't tell anything from it. So how you interpret this graph, on the left, the gold and the bronze, and it says insure, those are his costs over the year, combining an insurance product with the traditional approach of paying through the insurance company. On the right are 3 direct pay approaches with various coverage options. And what you'll see is that gray, that is premium. That is what you pay on your insurance every year for the sheer honor of having that card in your pocket. That's before you ever saw a doctor. He is almost $9,000 in the hole before he has ever seen a doctor. Now, he buys that expensive gold plan with the belief that when he accesses care, he won't have to spend much on the care because he's buried it into the premium. But as you'll see here, that's actually not true. He pays $539 above and beyond that astronomical premium price because he's paying a percentage of a false price, where if he had ignored that altogether and just gone with the direct price, as you'll see on the right, he pays $526, meaning he was better off if he had never used his insurance, had he ignored it from the beginning. And when you combine these two and you start looking at cost-effective coverage options like the short-term limited duration on the far right, so inexpensive coverage merged with cost-effective medical care, a healthy individual in a relatively normal year could save in actual aggregate costs over $8,000 in a single year. Now, Joe's pretty healthy. But let me reintroduce you to Bob. Bob's a little higher utilizer. He's a diabetic. He's getting older. Now, he tries to take care of himself. He still goes and gets his annual checks, annual labs. He gets flu swabs. Because he's a flu shot, because he's a diabetic, he gets quarterly visits and gets hemoglobin A1C with that. He has the medications. Now, again, those are the insurance prices on the left. On the right are the direct care prices. He gets sick, unfortunately, and has a bout of pneumonia. He gets an x-ray with that, 2 visits, gets his antibiotics. He has a scare with some chest pain. He gets a visit, an EKG, a stress test. End of the year, he pays $6,600 through the insurance-based approach for his care. A direct care approach, $982, not even $1,000. And what's really eye-opening looking at these numbers, if you look at the stress test in the insurance approach, it's over $1,800. His entire year of care, all his visits, all his labs, all his meds, the chest x-ray, the stress test, are half the price, the entire year of care, half the price in the direct approach of what the stress test alone was in the insurance approach. That's a savings of $5,600 in his year of care. And when you throw in coverage products, the difference becomes even more stark. Now as he's getting older, look at that happen to that gray bar. It exploded. This is the premium. This is what he pays for that gold plan. A 58-year-old male in Michigan in 2019 for a gold plan, it's almost $18,000 on an individual. This is not a family plan. And again, he thought he was going to save money by getting that expensive plan, but he still pays over $1,100 on top of that monstrous premium price when he goes through the insurance approach. If he combined less expensive short-term limited duration policy and went with direct care, he could save $16,000. $16,000 in actual costs, coverage, and access to care in a single year. All right, so we went healthy, higher utilizer. Oh, poor Jennifer. Jennifer, great person. She was healthy, trying to take care of herself again, getting her mammograms, getting her checks. She's picking up a box one day, and she feels a pop in her back, and her leg goes numb. Oh boy, she does a step therapy. She tries to figure this out, tries to be, reasonable in her care. She goes to see her doctor, starts some Mobic, does some stretching exercises, gets an x-ray, still having troubles, gets an MRI, gets 2 spine injections, right? $4,400 insurance, $688 for those 2 with the direct approach. Finally ends up getting laminectomy spine surgery. Through the insurance approach, her year of care could be as much as $101,000. With the direct approach, it's $11,000. That's a savings of $90,000 in 1 year of care. And if you think about that by extension, she could have essentially done 9 spine surgeries for the price of the difference in that price. Now, this is where we get into a unique scenario, because that was so costly that year that she's pretty much maxing out all these coverage products, except for one, interestingly enough. The short-term limited duration direct approach was still less, ignoring the insurance and getting spine surgery, than that deductible. She still was about $1,100 or $1,300 better off in that situation if she'd never used her insurance. But you do see in many of these scenarios that she's maxing them out. Interestingly enough, the gold plan was the most expensive under any one of these 3 scenarios. Healthy, utilizer, worst year of your life. So worst year of your life. Thankfully, those don't occur very often, but when you do need coverage. They're catastrophes. That's why catastrophic coverage is there, to cover catastrophes. Now, under this scenario, the health sharing is actually the cheapest, because though they pay more per year, they have a lower, they don't call it deductible, it's like unshared amount, but they have a lower equivalent on that. So again, looking at the comparisons here, this, if she just alters how she pays for her care, not rationing care. This is not rationing. In fact, I'd argue she's getting better care. She's seeing a doctor who can really pay attention to her. She saves almost 14 grand in that year. So we're back to our puzzle pieces. And we've seen what it looks like when you can bring them together. But if you really look at them close, what do they look like? Well, they look like you, and they look like me. The people literally in this room, sitting in the very chair next to you. We have the power in this room, doctors, TPAs, health sharing ministries, representatives from labs and imaging centers. We have the power in this room to reform and fix American healthcare, the largest part of the largest economy that has ever existed in the history of the world. And it all starts by designing a system around DPC. Doctors living their lives, loving their lives with a focus and attention to give their patients the best care that they can receive. And as we continue to look at these pictures, every little piece has its own picture on it. But when you put a puzzle together, it makes a grander picture. And we see that emerge here too. A picture of a functional, effective, cost-efficient, wonderful American healthcare system that's built on freedom, that's built on choice, and as the other panelists have mentioned, it's built on happiness. And I, for one, love the look of that. Thank you.
So my name is Lindley, and I'm direct primary care physician in Brock, Texas, small town outside Fort Worth. And I was asked to talk about why it's important for us to be involved. And we are involved in our patients' lives, but we kind of have to step out of that. We have to be actually involved more. To give you guys an idea, obviously you hear the accent I have. I was born in Yugoslavia. I left at the time, actually, it was still Yugoslavia. I left it. No, we declared independence. That's why we were attacked. So I left one day before the war in Croatia started. And I lived in Italy for 5 years. I worked as a nanny. I saved enough money, came to the United States with the Italian family I worked for. And I was able to change my visa from visitor to student. Went to college here, medical school, got married, have 5 children. And now I do direct primary care. I actually did a little bit of everything. I was assistant professor of medicine at my college. That was my initial dream job. And 9 months into it, I couldn't deal with politics of universities, so I resigned. We moved to Wisconsin, and my husband does interventional pain management, so we moved to Wisconsin, and I was part of a large physician-owned group, and that was okay, you know. I did what I had to do. And then I decided I wanted to raise my children in Texas. So I came to Texas, and I was hired as a medical director of 5 rural healthcare clinics. I started with 1 nurse practitioner. I ended up with 7. And I was going into negotiating my contract. I knew I was getting a raise. They knew they're giving me a raise. It was just a matter of deciding how much. During this conversation, I was told that my only job, by the way, I was seeing full-time panel of patients and supervising 7 nurse practitioners. And the way rural health clinics work in Texas, everything functions under director's license, which was me. So even the cleaning personnel is really technically under me. So if something happens, my license is in jeopardy. But anyway, I was told that my only job is to sign the nurse practitioner's charts. And I said, thank you, and I walked out. 1 month later, I opened DPC practice. So for those of you, granted, I already had my professional association, so I didn't have to do that. But for those of you who are planning DPC practice like 2 years from now, it's like I was telling Josh, Americans get engaged and they plan a wedding like 1 year or 2 years from their engagement date. It's like, why? Why? Anyway, in Croatia, you get engaged, or you actually don't even kind of get engaged. You're like, okay, we're getting married. You get married and maybe a month later. But it's the same thing about DPC. Why are you taking, unless you're in residency or whatever, and maybe your contract makes you wait, why are you waiting? You don't have to have this state-of-the-art clinic. I found the space. Stacy Benson was my mentor because she actually was trying to convince me for the past 2 years before I opened that I should be opening. I never wanted to be my own boss, never. But, you know, things happen and I decided to jump in. I found a place to rent. I had a stethoscope, I had my otoscope, and I had my blood pressure cuff that I bought first year of medical school. That's all I had. I opened, I ordered my strep test on Amazon, and then eventually set up Atlas, Sandomeds, and all that, and I am where I am. So if you want to do it, just jump in. You know, jump in and you're going to learn. You're going to make mistakes, but that's part of the journey. And you have enough people in this room that will help you. DPC docs pages that we all use on Facebook. Do you know how many times like I've read things and I've seen things and they're like, oh, try this. I still remember actually you doing some kind of freezing wort. And anyway, I ordered a little cylinder on Amazon that he recommended. But that's the point. This is not the way it was when you guys finished medical school and everything has to be lined up correctly. It doesn't work that way. Jump in. You'll buy things as you go along. Okay, so now we're going to talk why do I care so much. I grew up in socialized medicine, and again, I'm just so we put it out there. I'm a conservative financially. Socially, I'm more libertarian, but it has nothing to do with advocacy I do. When I talk to the legislators, I talk to Republicans and Democrats, because although healthcare should be a non-partisan issue, wake up, people, it's partisan. I know it should be non-partisan, but it's not. So wake up. Sometimes I have to talk to people that I don't agree with, but they might have great ideas. So this is something that we all have to realize. Being involved, taking care of your patients also means you making the trip to Washington, D.C. when it matters. Obviously, we are all part of the DPC Action Board. We go to D.C. all the time. There is a bill that we strongly disagree with. And I have 5 kids, right? My kids are 7, 9, 11, 12, 15. Sometimes they have to stay home with my babysitter. My husband is a physician. He doesn't get home until 9 o'clock at night. But my kids know that I care about this. And the only way we're going to fix this mess is us getting involved. So please, like, stop sitting on sidelines. If you see a post on Facebook, and actually, I think she posted something, and then I posted in a comment, I don't care if you agree or disagree with me. Get involved. If you disagree with me, push the bill. Call your legislator, push it. I appreciate that. I appreciate that you're involved. If you agree with me, then please carry me on through and help us defeat this bill. But this is not, I'm not talking about the bill. I'm just talking about the fact that you guys, I truly feel that if you want to save healthcare, and by the way, healthcare is not one word, healthcare is 2 words. Once healthcare became one word, it became an industry. But healthcare started as 2 words. Because whether you like Dr. Hunt's talk or not, it's a health care. We're supposed to take care of ourselves. And it's something that we all need to care about. So let's go back to socialized medicine, why I am passionate about this. And actually, my story is not, it's a sad story, it's not horrible, it's life, and I'm over it now. It's been almost 9 years, so I learned to cope with it. But I left home when I was 18, so I've been away from my family for a long time, and it's kind of hard to be part of a family when you're so far away, continents away. So when things happen, you kind of, you know they're happening, but you tend to compartmentalize, at least I do. So when my mom was diagnosed with ovarian cancer, we as a family decided to go private route. We paid for the whole thing. She had CT, MRI, surgeries. She recovered. Everything was great. But every winter, she would get what we call a flu in Croatian. She would go get treated, given medicine, whatever. She would recover. Well, one year she wasn't recovering. She was sick a whole year. And my family, since I was the youngest child, my oldest sister is 20 years older, my brother is 16, the other one 18, they tend to cuddle me a little bit, so no one told me that my mom was dying. So I am over it, so I'm really good. But anyway, I had to say goodbye to my mom over the phone because I was not allowed to fly. I was 6 months pregnant, and my mom was diagnosed with tuberculosis in a country that shouldn't have it. The reason she was diagnosed with TB because she got it a lot of years before, but no, the way socialized system works is you have to wait in line, you have to see a physician, you have to, things are not as ideal as we think they are. And when people say, well, you're just trying to scare us, this and that, we're not, we lived through it. Do you know that most legal immigrants, and I'm talking about legal immigrants, believe in Constitution? We believe in, most of us, not all again. Most of us believe in borders. Most of us believe in the right to bear arms. I don't have guns in my house, by the way, but I believe you have that right because we've seen the other side. The reason people come to the United States is because this is still the only country where you can have a dream. This is the only country where you can be born the poorest person in the world, but become a billionaire because of your hard work. I actually didn't realize until probably about 5 years ago that in Europe you really are tracked. So I never thought about being a physician. I've been a caregiver all my life, so I obviously have it in my, it's one of my characteristics. But the reason I never thought of that is because I wasn't tracked into medicine. I was supposed to become a chemist. So when I came to the States, I was a nanny for 2 ophthalmologists, and I was doing work with their kids and stuff like that, and they go to me, why don't you go into medical school? And I was like, yeah, why don't I? And I did. But the point is, this is the only country where you can jump up and you can jump and you can go down. Nowhere else you can. And again, I apologize if I offend anyone. It's not my intention. But the reason why I care is my experience in life. And what I'm trying to say is I really, truly believe that direct care is the answer to healthcare mess that we're in. Because we're the only people that show it can be done at low cost. Our patients love what we do. Medicine are not expensive, physicians are not expensive, labs are not expensive, radiology is not expensive, it's everything else. Hospital, insurance, because they're bureaucrats, they have to pay those people. So that's why that part is expensive. But the only way we're gonna get our voices heard is if you guys do something. If you can't go to DC, again, they know that I hate asking money, and I'm not asking anyone money right now at all. But if you can go to DC, donate to your senator. So next time there is a bill or something that matters, you can call that staff and they'll know you by name because you donate every month $50 and every so often you visit them when they're home. You can be involved in so many different ways. But if you want this movement to grow and to actually become something, we have to show them that we care. And I actually have lots of projects. One of them is actually introducing DPC into VA, and I will get there. Because one of my sayings in life is, what if I fall, but darling, what if you fly? So my point is, unless I try, I don't know if I'm gonna fail. And I've had meetings at the VA already, and it's gonna take me a long time, but I'll get there. I have no doubt that at some point at one of these conferences, maybe it's going to take me 10 years from now, I'll be here to say that we have DPC at the VA. I have no idea when is that going to happen, but that's what you guys have to realize. No matter how small it is, you guys can do it. Just so you know, out of DPC Action, I'm the one that understands the legalities the least. I actually pulled it up on my phone right now because what bothered me about that bill that I do not like was the cap. Why are they capping physicians? They've never capped anything in their life. Why are they capping me? They care about the 213, whatever, DPC. I don't even know. Every time I'm meeting with legislators, I actually have to write myself a little note so I don't mess up the numbers, because I tend to mess up the numbers all the time. The point is, I'm not an expert. I just care. And if every one of you cared and even did your stuff at the state level, in Texas, can you imagine that in Texas, one of the, we're so proud in Texas about everything. We're not dispensing medications. We cannot pass that freaking bill. No matter what we do, but we will pass it. But those are the things, there's certain stuff in your states that maybe you guys don't like about direct primary care. Do it. Go look up what another state did and it worked. I think there is an awesome dispensing bill in North Carolina or something. Look up that. Find one of the legislators you like, do a little fundraiser, and then say, hey, I have a bill. By the way, I wrote a bill for veterans that one of the legislators from Texas is going to introduce in Congress. I've never written a bill in my life. Anyone can do it. So I'm here just to tell you that there's so many things that all of you can do. Medicine is part of it, but medicine is not it. It's not the only part of it. To help our patients, we have to be involved. Whatever that is, if you want to do a fundraiser for your senator, fundraiser for your congressman, you want to send them a card, you want to get involved with us and go to DC with us and meet with people, whatever. But just don't sit on sidelines. Even if you disagree with me, disagree with me. By the way, my best friend is a Democrat and a Jewish person. Obviously, I just told you I'm a conservative Christian. But we have the best discussions ever, because we come from two different sides, and even when we disagree, we always find a common path. And by doing that, we can make things matter. And like I said, healthcare should be nonpartisan. But for those of you who are idealists in the world, wake up. Healthcare is partisan. You have a choice. Medicare for all or free market. Obviously, as part of DPC, I believe in free market because I feel that's the only way that we can actually give choices and patient gets to choose. We don't get to choose. Like, who are we to choose for them, by the way? That's what gets me. And when I talk to legislators, I don't talk only as a physician, right? I talk as a mom of 5 children, because the reason I do this is to leave the better world behind me to my kids. And I just want you guys to start thinking about what can you do, because you can do so much. Thank you.
Well, in my defense, I had a shotgun wedding, so my wife's not here, so please don't tell her I made that joke. I think the exciting thing about DPC is we took 10 years to get started. It took Starbucks 16 years to get 17 stores. DPC has grown from under 10, like Allison showed with the raising of the hands, to over 1,000 in under 10 years. But with 500,000 primary care physicians out there, we really are just getting started. It's very exciting. It's very invigorating to think what it will become. Chad had a fantastic talk about what healthcare is. DPC also, what is it not? It's not the headache, it's not the burnout, it's not the paperwork. We have residents who are here in second year dreaming of their practice. They're dreaming about what their slogans will be, who their staff is, what their mission and purpose will be. They're not worried about licensure and MOC and all this other noise. They're getting started without that original sin or that original headache and burnout of insurance and headache and stress and being told, like the last panel, what you will and won't do. To be able to do that in just under 10 years is amazing. Dr. Adil, if he's still here, being slightly unemployed for 6 months, called every pharmacy and every lab in the state of New Jersey to map out a system of resources for his patients. If we each are free of all that noise every day, the stuff we don't have to do, and we keep focusing on some sort of solution for the patients around us, this thing will go to 100,000 physicians in the next 5 or 10 years. And for every patient that we help and bring to DPC, if we save $5, $10, $80,000 per person per year, we'll change the course of history. The doctors in this room taking this message back out to their hometowns, their patients, their families, their small businesses, will spark a change that'll last a generation. It's an exciting and empowering thing to think about. Chad put it into numbers, 19% of the GDP, and there's economists recently who said we could probably cut 75% out of that, and he included direct primary care as part of his math. What does that buy us? 1% of that 13 fixes Social Security. 4% of that balances the federal budget. 5% of the GDP is things like military. So what could we do for this country if we were able to fix healthcare to the point that we fixed Social Security, had a balanced budget, solved educational debt, and all because we challenged a system that has never been challenged quite this way, like Chad alluded to. It might be a little pie in the sky. We are the crazy dreamers, but we are proving it. 400 docs who traveled, spent their own time, energy, and resources to come and learn and share about this is proof that we are the loud minority, and we are really making change. So if nothing else, give yourself a pat on the back, a round of applause, because you're practicing medicine the way it should be.
My turn? Okay, I'm last.
Yep.
Last but not least.
Oh, thank you. A double. Hi, everybody. I just want to thank everybody for coming, first of all, and all the new faces. I don't know what percentage, Lee, of new people, but there was a lot of hands. This is my 4th year. It's the first time I met most of these guys. Was 4 years ago at the first Nuts and Bolts in Dallas, and I remember Lee. I hadn't really known him. He was running around kicking his heels up. That people were coming from all 50 states signing up at the last minute. He couldn't believe it. So that was the first one, and here we are, number 4, and at least half of you guys are new. So that's super encouraging. And this movement keeps growing. And if it wasn't growing and making a difference and disrupting, we wouldn't be getting some of the attention we're getting, good and bad. So you guys all need to keep your finger on the pulse. We are making a change, just like Josh said. We could really change things for the next generation. And one thing I bring to the table that Lee and I are kind of, I'll admit it, I'm older than he is, but we're kind of the same generation. The older doctors, we remember what it was like before it became what it is now. And the younger doctors don't know what it was like before HIPAA and before the E&M coding guidelines. There was a time where we didn't have to code visits with 99212, 213, 214, 215. Believe it or not. There was a time where it was just privacy and it wasn't security. And I've lived through that change. And I just told somebody today, I said, I'm not going to stand by and watch it happen again. I've said to some people also, I look at DPC as a piece of fine china. You don't want to crack it, you don't want it to fall and break, because if you glue it back together, it's never going to be the same again. It's like pure. Right now, we got to keep, not pure versus the models that we talk about. I'm talking, we have to be careful that we don't let it chip or crack along the way inadvertently. We have to keep it as whole as possible. The model will morph, it will change. As time goes on, everything changes. But we have to make sure it's not ready, it's still in its toddler phase, it's just learning to walk. Why are we going to let people come in and tell us how to walk when we're not fully walking yet? So that's kind of how I look at it. This is a once-in-a-lifetime chance to make a difference, especially after the changes the system has lived through for the past 20 years, specifically the past 10. So know that you're making a difference every day. There are going to be some days that are difficult. Just pat yourself on the back. And know that you're part of a larger group, and you're making a big difference. And the world is watching, the country's watching. So thank you all for everything you do and your support.
All right, and this is Saturday afternoon in the happiest place on earth, and we still have a lot of people in this room. That's really, really exciting. I want to do some wrap up, a little bit of housekeeping. Again, this is your board of DPC action, so I'd like to give all these guys a real round of applause. If you look in your program, you'll see information about what the successes that our organization has had to date so far. But if you look up on that screen, the types of services that are the types of things that we're doing on a regular basis, we are always keeping an eye on Washington. We are getting constant updates, real-time updates as to what's happening. We're being barraged with information. We're being constantly contacted by state and federal lawmakers asking for our advice on how they should interpret things. We're asking for opinions on how to write legislation. We're being called by states and asking how we recommend that they reform their Medicaid programs. You know, we are independent physicians all around the country, and we're being contacted on a daily basis to help reform America's healthcare system. So we are actively involved and actively engaged in these things. And show of hands, how many of you have ever seen the movie Men in Black? That's a lot of people. So one of the things that I note in Men in Black is that every single day in Men in Black, they were always under some sort of attack, and the world was always on the verge of being destroyed, yet nobody knew it was happening. I'm going to tell you that that is our lives right now on a daily basis. There is not a day, there's not an hour that goes by that we are not getting some form of notification of how our profession is under attack. And this is a 24/7 operation that we need to constantly be responding and reacting to these things. This team is amazing. These people do not sleep. And so I would encourage you to go and follow us. Pick up your phones right now. Go on to Twitter. Follow DPC Action. Look for notifications from us. Again, I want to thank Atlas for their $5,000 matching donation. So the good news is we actually, our credit card processor, blocked the donations because we had too many small donations. So we had to change it. So if your donation was blocked, you want to up that donation? So if your donation, your small donation was blocked, we did go ahead and open that back up. So go ahead and do that again for us. There are CME forms available for you, so when you step out our registration desk, make sure you pick up the CME forms on your way out. And at the end of that CME form, if you're a first-time physician attendee and you're here on a scholarship basis, first of all, I just want to again thank the Physicians Foundation. That scholarship is from the Physicians Foundation. These conferences cost hundreds. These conferences cost hundreds of thousands of dollars to put on. A $700 ticket price does not cover your cost to attend this. So even if you're not here on a scholarship, you're actually still here thanks to the generosity of the Physicians Foundation and the work from Docs for Patient Care Foundation. So one of the things I would like to ask you is, our work here does not end after this conference. Our work here starts after this conference, okay? So our work here is year-round. I would ask you to do two things. Number one, follow the work of DPC Action. Make a contribution to DPC Action. No amount is too big or too small. Docs for Patient Care Foundation is also a nonprofit organization. If you're here on a scholarship, your $200 ticket reservation, or if you're a resident or a medical school med student, your $50 reservation for the ticket is refundable to you. We would ask you if you felt like you found value in this conference and if you like the work that our organization is doing to better this movement and to help advance the causes of healthcare for you and for our patients and for our country, I'd ask you to donate that amount of money to us. And that will be on your CME form when you fill it out. There will be an option. You can request where that refund will come to you, or you can designate that refund be donated to us. I would please, again, ask you to donate that amount to us. We do work very hard for you, and everybody up here is a volunteer. So, again, thank you, everyone. Thank you to our staff for Docs for Patient Care Foundation. They did an amazing job, our volunteers. A big round of applause for our faculty. These people are amazing. And again, I want to thank everyone for coming. Safe travels home. God bless you all. Have a great day.